Historians often end their examination of the Third Reich with ideology, geopolitics, and military strategy. But there is a story that rarely enters the main narrative, the story of a man in a white coat who, literally every single day for 9 years, injected into the veins of Nazi Germany's leader a cocktail of methamphetamine, opioids, hormones, and other substances whose composition and order were hidden from the patient himself. This man's name was Theodor Morell. And his medical practice from 1936 to 1945 is not a romanticized tale of illness, but a thriller about how one doctor achieved greater power over a dictator than all his generals, simply by holding a syringe and promising relief from pain that the patient perceived as personal humiliation. No, this is not a romanticization and not an attempt to find an explanation for evil through chemistry. This is a story about how one doctor gained absolute power over a man with absolute power, and how a system of silence allowed this to continue for 9 years while all of Europe burned. Documents exist, testimonies exist, and they tell a story that is simultaneously more banal and more terrifying than the myth of the Iron Fuhrer, whose organism was as fragile as his psyche. Who was Theodor Morell? A provincial doctor who became the greatest influence. Theodor Karl Ludwig Gilbert. Morell was born in 1886 in the small village of Treis-Münzenberg in Hesse. His father was a school teacher. His mother came from a family of wealthy farmers. It was a classic German provincial biography. Good upbringing, ambition, a medical career. Morell established himself in Berlin and engaged in private practice. He was a urologist with an interest in psychosomatic medicine, a doctor who believed that physical symptoms often concealed psychological causes. This was fashionable, it sounded scientific, and for patients it meant, the doctor listens to you and will find you a solution. But Morell was also a businessman. He developed his own pharmaceutical preparations, sold them to successful people, and by the mid-1930s was known in Berlin as a specialist in treating venereal diseases and stomach problems. He was popular, but not famous, simply a German doctor who earned well. The turning point in his fate came by chance, but was inevitable by the logic of the system. First contacts. How a patient chooses his dealer. End of 1936. A patient suffering from gonorrhea comes to Morell. This is Heinrich Hoffmann, Hitler's personal photographer and close friend. Morell treats him successfully. Hoffmann is grateful. Hoffmann begins to recommend the doctor in his circle. Then Hoffmann introduces Morell to Eva Braun, Hitler's companion. Eva Braun also becomes a patient, and then, almost inevitably, at the end of 1936, Morell is unexpectedly invited to a Christmas party at the Berghof, Hitler's Alpine residence. What happened at that party is not exactly known, but in a private conversation, Hitler asked Morell to take over his medical care. He was particularly interested in chronic stomach pain and eczema on his feet. Hitler had suffered from chronic stomach spasms since childhood. This was not a rare illness, but for a man who feared losing control over his own body and the world, each spasm was humiliation, weakness that he could not show to anyone. Morell's first examination, which took place the day after the invitation, showed that the doctor was ready to give what the patient wanted to hear. I will help you, I will fix you, within a year. Medicines that became fate. From Mutaflor to the illusion of perfection, Morell started with the harmless. Mutaflor, capsules containing a safe strain of E. coli bacteria. It was a remedy for restoring intestinal microflora, and it worked. Within months, Hitler could eat normally. The spasms ceased. The eczema on his feet disappeared. Morell obtained what any doctor with a dictator had been seeking: absolute trust. Hitler was convinced that Morell was a medical genius. Morell became his Leibarzt, personal physician, and later received the title of professor. But simple treatment quickly turned into something entirely different. Within months, Morell introduced daily injections into his practice, every day, without exception. The reason: Hitler was an active man managing the state, and he needed energy support. Morell developed his own preparation, which he named Vitamultin, or Vitamultin calcium. Officially, it was a mixture of vitamin B1, ascorbic acid, calcium, and nicotinamide. In practice, it was more. Vitamultin contained Pervitin, methamphetamine. It was the same Pervitin that the German army distributed among soldiers to increase combat effectiveness, the same substance that allowed the Germans to cover 60 kilometers per day during the 1940 Blitzkrieg. But for Hitler, Pervitin was wrapped in the packaging of vitamins and medical authority. It was not a drug. It was treatment. It was science. It was help. Methamphetamine and war. When army and leader share the same dose. To understand Morell's medical logic, one must understand the military context. In 1938, the German pharmaceutical company Temmler synthesized methamphetamine and began its commercial sale under the brand Pervitin. At first, it was a legal stimulant like coffee. It could be purchased at pharmacies. It was recommended for fatigue, depression, obesity. When World War II began, German military command realized Pervitin could be a strategic weapon. Soldiers who don't sleep, who don't feel pain, who are filled with confidence, these are ideal fighting machines. In April-May 1940, before the invasion of France, the Germans produced 35 million doses of Pervitin for 3 million soldiers. Twice a day, often in the form of Panzerschokolade, chocolate for tank crews, soldiers received 3 milligrams of methamphetamine. The result was impressive. Under the influence of Pervitin, tank divisions covered 22 km per day under enemy fire without feeling fatigue. They barely slept, barely ate, did not feel fear. The Luftwaffe, German pilots called it pilot salt. It allowed them to remain alert for 40-hour bombing missions. And if methamphetamine worked for the army, why not for the leader? Morell, as a wartime physician, saw in Pervitin not a drug, but a means of military necessity. Hitler was a fighting unit of the state. His health was a state resource. His exhausted organism needed to be stimulated, just as soldiers' organisms were stimulated. By 1943, the daily Vitamultin injections contained an obvious dose of Pervitin. Hitler did not know this precisely. Morell always masked the composition, speaking of vitamins and tonics. But every day when Hitler woke up sluggish or unsure, Morell brought a syringe, and within minutes everything changed. Energy, clarity, confidence, rage, it all came at once. How addiction progressed. From cure to slavery. The mechanism of stimulant dependence was well known to science. The organism becomes accustomed. The effect diminishes. A larger dose is needed, then even larger. And after a few years, a person can no longer function without the substance. By 1942, Hitler was completely dependent on Morell's injections. This was no longer treatment. This was survival. His day began with an injection. The day continued with an injection. The day ended with an injection. And when the army began to lose 1943 to 1945, the dose increased. Because pressure on the leader grew, and chemistry was the only way to create an illusion of control. The documented list of substances that Morell injected into Hitler shows the depth of the chemical cocktail. Pervitin, methamphetamine, the main stimulant. Bromnervatzit, bromide and barbiturates, sleeping pills, to counteract insomnia caused by methamphetamine. From August 1941, almost every night. Eucadol, oxycodone, an opioid for pain. Cocaine, in the form of eye drops and injections. Choramine, nikethamide, a stimulant to counteract barbiturate overdose. Hormone injections, testosterone, estradiol for energy. Heart and liver extracts, for the heart and liver. Prostacinum, extracts of seminal vesicles and prostate from young bulls, injected twice weekly to combat depression. Dr. Koster's anti-gas pills, containing belladonna and the poisonous plant Nux vomica in high doses, 8 to 16 tablets per day. In total, over 9 years, Morell administered Hitler with more than 74 different substances in 28 different combinations. This was not medicine. This was chemical life support on the edge of what a living organism could endure. Pain and disease. When the body becomes an enemy. Against the backdrop of this chemical cocktail, real diseases progressed. Hitler suffered from colitis, chronic inflammation of the colon, probably irritable bowel syndrome, IBS. This was his main complaint throughout his life. Spasms, diarrhea, constipation, all of this cycled, and Hitler perceived each attack as a personal humiliation, as a betrayal of his own body. He had eczema on his feet, heart problems, frequent colds, and all of this could be suppressed only by Morell, not by treatment, but by masking symptoms. But the most terrible disease appeared later. Parkinson's disease and hidden diagnoses. By 1941, Morell noticed something strange. Hitler developed tremor, shaking, predominantly in his left hand. Morell first attributed it to stress. It was not stress, it was Parkinson's disease, a neurodegenerative disease that, without treatment, progresses to complete disability. German neurologist Maximilian de Criny, examining German newsreel footage from 1944, clearly diagnosed Parkinson's, tremor in the left hand, slowness of movement, rigidity. But officially, Morell acknowledged the diagnosis only on April 8, 1945, a week before Hitler's suicide, and what he did in response, he began electrogalvanic therapy, a completely ineffective remedy that only further exhausted the organism. Why did Parkinson's appear? Partly it could have been a natural disease, but there is evidence that methamphetamine accelerates the development of Parkinsonism or can provoke it. Years of daily methamphetamine could have destroyed the dopaminergic system of the brain that controls movement. There could be another cause. In 1942, historians discovered a medical report that Hitler possibly contracted syphilis in his youth and was allegedly cured from it, but symptoms returned in 1937. Neurosyphilis can cause Parkinsonian symptoms. But regardless of the cause, the disease progressed and Morell had nothing to stop it. He could only administer more stimulants to mask the progressive decay. Final months and decay. When treatment becomes torture. From 1943 to 1945, Hitler was in a state that historian Norman Ohler called the heavy opioid phase. The war was going badly. Military defeats were undeniable. And instead of adapting strategy, Hitler withdrew. He ventured out of the bunker less and less. He shouted at generals more and more often. His decisions became increasingly impulsive and detached from reality. Morell, seeing his patients decay, did not recommend sobriety or treatment by other doctors. He increased the dose. By the end of the war, the doctor had to make regular stops during Hitler's train journeys to administer injections. The inside of Hitler's elbows became covered with scars from injections, traces of thousands of needle pricks. In December 1944, German bombing destroyed the Merck factory in Darmstadt, where Eukodal, oxycodone, was manufactured, the main opioid in Morell's cocktail. Fearing supply disruptions, Morell began giving Hitler massive doses of oxycodone to create a reserve in his system. The result was catastrophic. Hitler had become a man who could barely stand. His movements were slow. His face was a mask of Parkinsonism. His hands shook. His voice was barely audible. And in April 1945, in the last days of the war, all three of Hitler's physicians, Morell, Brandt, and Giesing, began to see the obvious. Their patient was deteriorating, and they were helping him deteriorate. Giesing recommended stopping the injections. Brandt and Giesing proposed alternative treatment. Hitler flew into a rage. He declared that he had complete trust only in Morell and his treatment. He fired Brandt and Giesing. Brandt would later be sentenced to death at the Nuremberg trial for participation in medical experiments on prisoners. Morell remained. Morell was the only one. On April 22, 1945, a week before his death, Hitler fired Morell in a fit of rage, threatening execution if he did not leave. Morell begged him to reconsider but was expelled. Morell returned to Munich. On May 1st, he was hospitalized with heart problems. On May 2nd, the Americans occupied his hospital. Days later, Germany capitulated. After the war. The fate of the doctor-dealer. Morell lived until May 26, 1948. His death was agonizing. He was not tried at the Nuremberg tribunal. It was considered that his main guilt was in being near a criminal, not in committing crimes himself. In stories of other doctors' refusal to maintain medical ethics during Nazism, Brandt Giesing, Morell often remains in the shadows. But documents exist. Morell's diaries, which he kept for years, probably for self-protection, contain a list of almost all the substances he gave Hitler. These diaries were captured by Americans and are stored in archives. Historians, particularly Norman Ohler, who wrote the book Blitzed, Drugs in Nazi Germany, 2015, use these documents to reveal the scale of chemical dependence in which Nazi Germany's leader found himself. And here is what matters. Morell was not alone.